Through the course of genetic testing of someone's cancer, our goal is to identify a needle in a haystack, meaning what genetic change makes someone's cancer go. And what I mean by that is these genetic changes can give cancer the two properties that make it bad. The first property is that it can grow and grow and grow. And the second is that those cancer cells travel to other parts of the body. So finding that needle in a haystack is the challenge, because there may be thousands of needles in that haystack, and figuring out which one is important for therapy is our challenge. A couple years ago, we learned from one patient where it didn't matter which needle it was the fact that they had so many gene mutations. That was the important observation. And so this pattern we now called MSI, or microsatellite instability, and that basically means a lot of mutations in your cancer. And it turns out that this pattern can be found in almost any cancer type. Up to 3% of cancers can have this pattern called MSI, lots of mutations. If you have this, you could benefit from therapies that boost your immune system. The idea being your immune system isn't strong enough to identify that cancer in your body, even though it has all these extra mutations. And so it turns out that immunotherapies to boost the immune system can eradicate your cancer if you have this marker. And so we were able to observe this in one patient who then taught us how to find it in other patients. We developed an algorithm, we developed a test, and lo and behold, years later, now we have new therapies being developed for patients with MSI-high cancer.